holding the pen at the time. That's how this happened. So we talked about fourth year electives, and this kind of builds off the third year elective and some of the difficulties and really generating some of the problems that are here. Every school, at least up into the first 3 years, is relatively standardized, but once the fourth year hits, it's wide open as far as what can happen. A lot of schools use this time to have students go away, especially the ones they don't like, and other schools try to keep them in close. And so with that problem, how do you really manage a body of students that's all over the place? And so we thought, is there a way to there's a pretty big mix between people that have primarily ultrasound electives, and very few programs actually have dedicated required coursework for the fourth years as a capstone course. And so those problems and issues of the different locations, and many of you have multiple clinical sites, especially in your fourth year. Class size, when you have 100 students, it's a difficult task, but if you have 250 to 300 students, it's also an unwielding task as well. And then resources at all these sites. Do the equipment that you have at the VA match the equipment that you have at your main campus, and is the depth of your material at different sites the same? So all these sort of issues play into how you can really manage that fourth year. And then kind of the bigger question for a general needs assessment is what's really the goal of your fourth year institution, and how does this line up with ultrasound? Is this going to be more of a preparation into their internship? And if so, should we be focusing more on specific skills rather than getting just a diagnosis list or a case list? So when we talk about the learner needs assessment, it's more of the, when it comes down to, almost the best way to describe it, is sticking needles and stuff. If there's one common thing they need to be able to know before they get to their internship, it's how to safely stick needles and stuff. And so if you think about that as kind of the main starting point for looking at a more comprehensive or integrated curriculum piece, that covers all specialties, hopefully maybe not so much in psychiatry, but at least as their interns, they may have that opportunity for difficult IV access, et cetera. And then it kind of breaks out from that point of the two components, which is the image recognition. And since the students are very disseminated, could you approach it more as a CME model for them to really pepper them with the image recognition tasks and work? And of course, the image acquisition, which are the same problems we have, but it's a little bit more difficult with the multiple sites that they have. And just a reminder that all these pieces don't necessarily have to fit in a clinical space, even though they are in their third and fourth year. Goals and objectives, the best way to really look at this is how do you really prepare them for internship, and that's kind of one of the pieces that we looked at the most as kind of the guiding goal. And so it kind of blends in with some of the other discussions that are had, but the bigger piece is, could we fit this in with the EPAs, the trustable protected activities that are starting to come up now. Now, these haven't really been addressed in fourth-year students in general by accrediting bodies, but this could be an opportunity for us to sort of almost be ahead of the curve, so that when EPAs come up in in medical student and then residency training, could we have sort of ultrasound curriculum that ties to that specifically. Strategies, kind of going back to this idea of gamification, thinking about kind of badge systems, or being able to get a certain number of scans or a certain number of components. There's a great example from University of Kentucky where if you get a certain degree of skill set, you get actually a special pin that designates you as a super user. And then everyone knows that that's like the pin to go after and to not trust anyone else. But it's sort of a good approach. Medical students are inherently really competitive, but it also rewards the students that are going to go that extra mile and become your super user group. And then kind of looking at other things for now that everyone has a very different focus, and they are focused on residency and getting into residency, looking at an ultrasound project-based approach based on that specialty that they're going into, and of course the issues of fear. Fear is a good strategy as well. Faculty and peer review. Again, the implementation piece is always going to be difficult when you have such a decentralized model in your fourth year, and you're going to have these varying levels of oversight by faculty, and so how can you standardize that experience? That's always the concern you have from an accreditation standpoint, is that all the faculty come together, how do you make sure that one site is the same as the other if you have a required experience? Again, another great example from Kentucky as far as volunteering in the evening and peer-to-peer teaching, and really using that to create more opportunities for the student to engage as leadership as well. Using the idea of the ultrasound portfolio or the student portfolio, creating a similar type ultrasound rounds that highlights the skills and the cases and kind of gives the students more of an opportunity to present their work, and this idea of maybe a student review portal that's centralized across the institution. Feedback, again, OSCEs are an easy way, at least logistically, to pull everyone back together to assess their clinical skills. And then some of the issues with maybe a student review or peer-to-peer review is just more of the time, and maybe even trying to leverage sonographers to help out in this workload of looking at all these